Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
There's always an issue when a clinician wants to prescribe either a nutrient or drug for an individual and match it to chemistries, etc., of the blood work. And we need to discuss just for a moment bioavailability and the little topics around it to help understand us and what we're doing for these patients better. Bioavailability refers to the proportion of a nutrient or drug that enters a circulation when it's introduced into the body and it's able to have an active effect. It plays a critical role in determining the efficacy of both nutrients and medications. And several factors will influence that, including the form of the nutrient, the drug, the method of administration, and individualized physiological differences. Well, there are genetic differences that we all have. These variations can affect enzyme activity, which definitely can influence how the nutrients or drugs are metabolized. Age and gender also add into this because that can affect the metabolic rates and hormone levels that impact the bioavailability too. Health conditions like liver disease, for example, kidney disease may alter the metabolism and excretion of these substances that affect the bioavailability. And when it comes to nutrients, the form and source make a whole great difference. The form of a nutrient can greatly affect its bioavailability, as like magnesium oxide compared to magnesium chloride, for example. Interactions of certain nutrients with themselves can either inhibit or enhance absorption. Example, vitamin C enhances iron absorption, B12, while calcium can inhibit the absorption of iron. There are digestive issues of health, like the digestive system factors like gut flora, enzyme levels, and they can also affect how your nutrients and absorption work. And then, of course, if you want to think of drug bioavailability, which we should for a moment, the administration route that orally may have a much lower bioavailability due to its first pass mechanism, the liver, whereas intravenous, and this goes for nutrients as well, pretty much ensures 100% bioavailability, and hence why I'm always looking at the intravenous route for nutrients, at least to start a person's protocol. The chemical properties, the solubility and stability of the drug can affect also how well it's absorbed into the bloodstream. And you have to also recall that lab normals versus lab optimals are very different. Normal ranges are statistically derived from a population which doesn't reflect maybe the optimal for that individual. And that really needs to be understood, especially when you're looking at even nutrient levels like vitamin D. Diurnal variation of many substances like cortisol have natural fluctuations. All hormones do because they're pulsatile. And depending when you test, you may get different results and not accurately reflect what's going on. And of course, the timing that you give a nutrient and drug intake based upon bioavailability is extremely important. Medications often are absorbed, like nutrients, some of them on an empty stomach, while others require food. So basically what I'm saying, this personalized nutrition and medicine or this metabolomics are paving the way for more personalized approaches. And taking into the concept, bioavailability is optimized when you base it upon the individual's unique genetic makeup, lifestyle, and the labs in depth that you have to be able to determine what's best for that individual. We'll know more about this in the future. Thanks so much for watching. I'm Dr. Mitch.